All right, so I'm Tyler Spivey. I'm a nurse practitioner student here at Murray State. I got Jake as my patient, and we're going to perform a musculoskeletal exam. So first, looking at the body alignment, no deformities noted or present. The shoulders are in line with the iliac crest. Everything is symmetrical. No issues there. Now I'm going to take a look at the spine, looking at the cervical, thoracic and lumbar parts of the spine. The curvature is normal. No issues there at all. Now I'm going to ask the patient to bend over with his spine to assess scoliosis. The spine is midline with no bending or scoliosis noted. Now I'm going to move to more of the facial region. I'm going to test range of motion for TMJ. So just move your mouth up, down, side to side. Very good. Range of motion is present there. No TMJ noted there. Now we're going to check the range of motion of the cervical region. So just move your head side to side, up and down. Very good. Past that. Now we're going to look at the spinal region. I'm going to assess range of motion there. So keep your hips still and just move your spine back and forth. Very good. Very good. Past the spinal range of motion. Now we're going to test the sternocleidomastoid muscles and the trapezius muscles. So lift up with your shoulders. Very good. Now lean against my hand. Very good. With this side. Very good. So all range of motion in those categories are passed. Now we're going to look at the upper extremities. We have fingers, hands, wrists, elbows, and shoulders. We're going to look at tenderness, if there's any tenderness present, warmth of the skin, crepitus as well. So the skin is warm, no issues there. Any tenderness anywhere? No. Okay, no tenderness noted, no crepitus noted as well. Very good. So now we're going to do range of motion of all of these different things. So fingers first, good. Now hands up and down, side to side, very good. That tests the wrist as well. Now elbows in and out, good. Shoulder range of motion, very good, perfect. So all range of motion is intact, no issues there. Muscle tone of the patient is adequate and good. Patient has good muscle tone there. Now we're going to test for strength. So just hold your fingers out. I'm just going to squeeze your fingers, good. Plus or 5 out of 5 strength of your fingers. Same with your hands. I'm just gonna just kind of squeeze my fingers just to assess hand strength. Very good. And then I'm gonna push against you and just kind of like try to put your hands out. Very good. Same thing with shoulder strength. I'm gonna push in. You can kind of go out. Very good. And then hold your arms out and push down. You keep your arms up. Very good. And then we'll go the other way. Good. Good. So 5 out of 5 strength with the upper extremities. Now we're gonna look at the lower extremities. This includes the feet, ankles, knees, and hips. We're going to do the same thing as we did for the upper extremities, tenderness, warmth, crepitus, all of that. So, Jake, you just let me know if there's any tenderness in any of these regions. Any tenderness? No. Okay, no tenderness noted. Patient's skin is warm throughout. Now we're going to test range of motion for all of these. So we'll start with your feet. Kind of just go in and out. Very good. With your knees, you can go in, out, which also tests the hips range of motion as well. So no range of motion concerns. Also assessing the patient as the patient walked in. He had no range of motion concerns as he walked into the exam room. Also the patient's muscle tone is adequate. It's good for the patient's gender and size. And also we'll test for the strength of the patient's lower extremity. So I'm going to press on the feet, the knees, the hips, and we're going to assess the strength of these. So pressing against the feet, that's 5 out of 5 strength. I'm going to push in on your knees. You just pull out. Very good. And this helps out with hip strength as well. So 5 out of 5 hip strength or lower extremity strength with the hips, the knees, and the feet. So no issues with the musculoskeletal exam, and that concludes it.